Well, it all began with me feeling tired. I didn't have a lot of drive. Um, I found myself wanting to take naps. Especially after work. After I work 8 hours, I want to go home and just lay down to kind of get a second wind for the second part of my day. I have a couple of kids, and um, I do a lot of cooking and cleaning, which I love to do in the household. So after I get off work, so I work from 6:30 to 3, Monday through Friday. When I get off of work, I would find myself going home, sitting on the couch, and just dozing off to sleep. Sometimes sleeping till 5 or 5:30, just to have enough energy to kind of go through the second part of the day. For me. Um, on top of that, I'm 49 years old. My sex drive is not where it used to be. Um, and so I started thinking, well, what about my testosterone levels? I hear a lot of commercials. I've read things that talk about, how testosterone starts falling off as men get older. And I just didn't feel like I was 25 anymore. So with that, I also didn't have a whole lot of drive. Not like it used to be, where you'd be sitting around the house and just constantly trying to find something to do. Or I'd find myself sitting on the couch, be perfectly fine, like a couch potato, sitting there watching television with the remote control, and not necessarily feeling bad about not getting up, because I just didn't have the want, to do anything. And I one day I just kind of asked myself, I said, what is this normal? Should I be feeling this way? So I started doing some research on how men feel with low testosterone, and everything that I was feeling was kind of pointing towards, having low T values. And so I decided to do something about it. This was probably about a year, maybe a year and a half ago. So there's a lot of commercials on the radio. I see them on television about low testosterone and low testosterone therapies. There's a lot of clinics out there that kind of walk in and get testosterone therapy, whether it be through shots or implants or pills. They advertise on TV. There's these pills that you can buy, and it's supposed to do all this great stuff. And so I decided that I would go to a low T place for testosterone therapy. And when I called my insurance company, they were like, yeah, we don't really cover that. And so I thought, well, okay, let me just give it a shot, out of pocket. So it ended up being quite expensive. I think I paid a couple $100 for the office visit. So I go in, meet this guy that wasn't even a doctor, and he even openly said, I'm not a doctor, but we do testosterone therapies, and what we're going to do today is pull your blood, and we're going to run a 15-minute test to see where your testosterone levels are, and then we'll figure out a treatment for you after that. I said, okay. So they do so, and comes back into the room about 20 minutes later. It's like, yeah, you're definitely low. You're down in the 300s, or 310, 320 range. Most men, in their early 20s are pushing 800 to 1,000, something like that. So it's substantially lower. And I thought, yeah, let's do this. And at the time, I was like, it doesn't matter what it costs, because I'm just really tired of sitting on the couch and having no drive to even cut the grass anymore. My car, I used to always wash it, and now it sits there dirty because I don't want to get out there and do it. So I'm like, okay, fine, I'll pay whatever. And so after the $200 for the office visit, the test and the blood draw, there was like another $200 for the implants. And I chose implants because there were 3 types of therapies that they offered. And again, this is therapy. It's not really yourself producing anything. So they offered shots, and they offered pills, and they offered implants. I chose the implants because it was explained to me that you're taking pills, and when the pills start to wear off, then you feel the slump of testosterone. Because I wasn't really producing it myself, it was an artificial substance that I'm putting in, so my body says I don't need to produce testosterone because it's there. But when it wears off, then you start going down with it. The same thing with the shots. The shots are like once a month. Um, Day 20, day 22, you'll start to feel the decrease. And by day 30, you're kind of back to where you were, feeling like you were before on the couch. The pellets or the beads, the implants, were a little bit more consistent because they would be implanted and they would slowly dissolve and rise up and then kind of keep a level playing field for about 6 months until they start to fall off. And for me, it was like right at 5.5 months, and I started feeling it. It's like, okay, this is going down. Um, I didn't like the way that the pellets were implanted in me, so I decided I wasn't going to do that again. Um, One of the things that they did there at this T center, low T center place, um, was they made an incision in my buttocks, my rear end. First they deadened it, then they made an incision. They spread the incision open with a pair of cryos or it's like a surgical device, and then they push these pellets like into your fatty part of your rear end, and I could just feel them pushing. And, there's a lot of pressure, but there's no pain because I was deadened. Um, After 4 or 5 hours after the medication wore off, of deadening it, it just became very painful. Like I couldn't even really sit on the right side. I'm sitting in the car, kind of sitting on my left side because my right side is really hurting and burning. Um, and then within a couple of days, I get out of the shower and I look in the mirror and I have this spot, literally like this big, nothing but bruised all the way down my right buttocks area. And I thought, man, that just looks horrible. I took pictures of it, and just what I did to my body. It's like I feel good. I feel great, but I don't want to ever do that again. The testosterone treatments made me feel really good. Made me feel like I was 25 again. But the downfall to it is that I knew it was going to go away, and I knew that I was going to have to relive this experience. So at the end of the 6 month period, 5.5 months into it, it started to decrease. I was kind of at a crossroads. Do I do this again? Do I go through this again? And I decided I would just kind of rather feel a little bit lazy than to go through those implants again. So I chose to not do so. Well, I work at the hospital and I work in surgery, and I work with Dr. Shaw on occasion. He comes in, and what Dr. Shaw to me is just a good doctor, as far as I'm concerned. I mean, I see his bedside manner, the way that he treats his patients. Before surgeries, he's always, checking everything 2 or 3 times to make sure it's just perfect. Um, he's very kind. He's never ugly, but he always lets you know. If he wants something specific for his patient, he lets you know, and we always get that for him. So after working with him it's been 2 years that I've been in the ORs, working with him. I can just really see that he's kind of like a complete package. I mean, he thinks of everything prior to the surgery, during the surgery, and after the surgery, and the follow-up, and the way that he is with us as a staff, the way that he is with his patients, um, the things that he decides to go above and beyond when he's treating his patients. One day I was just kind of thinking to myself, if I had a doctor, I'd like for him to be like Dr. Shaw. Dr. Shaw's a urologist, so I don't really have any urology problems yet. Hopefully, I never do. Um, but one day I kind of Googled um, low testosterone and what type. I think I spoke into my phone saying what types of doctors do low testosterone, and it came back urologist, and I was like, wow, well, this is my opportunity to use Dr. Shaw. So I spoke to him in the OR one day after he walked out of the room. I pulled him aside and said, hey, I think I'm suffering from low testosterone. I explained to him the story about me going through testosterone therapy like a year ago, and asked him if there was anything that he could do for me. And he said, "Sure, come in. Let's take a snapshot of what's going on with you. Let's pull some blood and see where your numbers are, and then we'll take it from there. We'll talk about some options, you know." And so that's really the reason why I chose him, is because I'm just a really cool dude. He had he was very thorough when he was speaking to me, and one of the things I like about Dr. Shaw is he doesn't like rush you in when you're in the exam room. I mean, he takes his time to explain everything that he's going to do, and he makes sure that you understand what he's telling you, which to me is very important when you're dealing with a doctor. So the options were he didn't like the idea of me going on any type of therapy. Therapy meaning pills or shots or implants, because he felt that I was young enough. I'm 49. He felt that I was young enough to produce my own testosterone. He had prescribed me a medication, and I don't know a whole lot about the medication other than the fact that what I read on it is that it stimulates the pituitary gland to stimulate the testicles to produce testosterone in men. And in this way, I'm producing my own testosterone. Mm-hmm. I'm not getting something that's synthetic that could possibly cause a reaction. And my insurance covered it because it's an actual doctor. I'm actually seeing a doctor for this. So my option was to take the medication. He wanted to start me out on a low dose to begin. So I think I was prescribed like a 50 milligram pill. And I was just breaking the pills in half, taking 25 milligrams a day, every day. And I think I had a 3-month, about a 3-month supply. The pills are real easy to swallow, they're small. So within about 7 to 10 days after starting the pills, the medications, I started to feel a little bit different. Started to feel a little bit more giddish, started to feel a little bit more drive, kind of wanted to do a few more things. Was kind of flirting with my wife a little bit more, doing all the things that I kind of really wanted to do before. And so after taking the medications for a little while, I really started to notice a difference. But there was another thing, another option that he had mentioned to me. I'm not the skinniest guy on the block. I'm 259 pounds, I believe, whenever I started this thing. And Dr. Shaw had mentioned to me that, belly fat can reduce testosterone levels. And I forgot the percentage, like 40% or something like that. So he says, if you try to get a little bit healthier and lose some belly fat, then your testosterone levels will increase even more outside of just the medications. And I think that his comment to me was, do what I do. When you have a sandwich, just lose a slice of bread. Eat half eat only one slice of bread instead of eating 2 slices of bread. He also kind of asked me what my sugar intake is like, and I was consuming quite a bit of sugar on a daily basis, and 2, sometimes 3, even 4 tablespoons of sugar, plus like a French vanilla creamer, in my coffee, because I love sweet coffee. And he said, look at reducing your sugar levels, because bread, when you consume bread, it pretty much turns to sugar, glycogen in the body, and that's creating some tiredness. It's creating some extra body fat, and by knocking that down, you can kind of lose some fat, which is going to naturally increase your testosterone levels as well. So that was really the main options that he offered, and I kind of took it and ran with it. I started doing a bunch of research after that, and I've done more than just lost a slice of bread. I actually started a ketogenic lifestyle, which I absolutely love because of the way that I feel. And 2 slices of bread is somewhere around 25 carbs, and that's all the carbs that I consume on a daily basis now. I don't consume more than 25 or maybe 30 carbs a day, and I feel great. From the minute I walked in, first of all, I have to say Dr. Shaw's office is really cool looking. I love the colors. It really mimics who he is. I mean, he's a neat guy. He dresses well, and the office is really sharp looking. First of all, secondly, as soon as I walk in, someone's saying hello to me. So I came in, told them what I was here for, sat in the waiting room. I was probably in the waiting room maybe 30 minutes at most, but 15 or 20 minutes of that was me filling out the paperwork. So they took me right in right away. Asked me about my day. They act like they really cared about me as an individual. I wasn't just someone else that was just walking in to see the doctor. They were very complimentary, and brought me to my little exam room and made sure I didn't need anything. They even come to check on me while I was waiting for Dr. Shaw, which I thought was really nice, because a lot of times you go to the doctor and they put you in an exam room and you just sit there and you wait and wait, and he may get tied up with someone else, but they'd come by and say, hey, you doing okay? You'll be here just a few minutes. They get you some water or anything, which I thought was really nice touch. Very kind folks. I've had to call into the office a couple of times, mainly because of the medications and trying to change where I was going to pick the medications up at. Originally, I was going to go with Walgreens, and then decided to go to Randall's, but then I ended up going to HEB to get the prescriptions. So when I would call, just leave a message, let them know what I was wanting. Within a couple hours, they always call back that day. They'd call back, and I would tell them in detail what I wanted to do on their voicemail message. Then they'd call back and say, okay, it's done. I didn't have to re-explain it so that they would call in. We've already taken care of it. We got your message. Thanks for being so detailed with it. It's done. You can pick them up whenever you're ready. So it's a great experience. If I can sum it up, learn to listen to your body. Knowing how your body responds to things is key. Knowing what your numbers are. Have some blood work done so you can see, okay, my testosterone levels are here, my thyroids are here, my inflammation levels, are they high? I wasn't pre-diabetic, but I was, probably like Dr. Shaw said, that if I kept living the way I was living 10 or 15 years, I could certainly be diabetic, because my A1C was like 5.7 or something. I think 7 is like when you become pre-diabetic, and I didn't want to be a diabetic. It's a tough lifestyle. I wouldn't say it really struck fear in me, but it really kind of made me wake up and think to myself, what am I going to do to change all this? And then start to pursue some avenues that can change it. And for me, it was going on the ketogenic lifestyle. It was losing the bread, losing the sugars, quit all the sodas and soft drinks. I love the Little Debbie Swiss rolls, especially in the freezer. They're fantastic. I still have them, but it's very rare, maybe one a week, like on a Saturday evening. I have one kind of as a reward. But the way that I feel with this new lifestyle is just amazing. I mean, I have tons of energy now. I don't do energy drinks like I used to. I used to drink one at the minimum, sometimes two and even three a day, just to kind of get through the day. Not to mention 2 cups of coffee in the morning and even cups of coffee in the afternoon. So it felt like I was constantly searching out caffeine or taurine or one of the stimulants to kind of get me through the day. And I haven't had a soda, I haven't had a Monster, which was my choice of energy drink, and AMP. I haven't had any of those things. I still drink coffee because I love coffee, but I only have 1 cup a day now. It's in the mornings. Um, but I haven't pursued any of those things in 5 months now. I've been seeing Dr. Shaw for 6 months. Um, so that's no longer even part of my life. And I feel a lot better without the energy drinks because I have the energy that I need now. And again, it's just from going through the ketogenic lifestyle and lowering my carb intake and increasing my fat intake, keeping my calories around 2,000. My net carbs are 25 or 30 net carbs a day. Protein's about 120 grams a day, and then my fat content's about 160 grams a day. I got this really cool app called Senza, Senza, that I use that tracks my food every day. So I get to scan a barcode on the product, and it'll put right in there what it is. And so I use that to kind of see where my numbers are. So when I first came to see Dr. Shaw, and he talked about my belly fat and losing some weight, I didn't know what I weighed, but prior to coming in, so I wasn't really tracking it. But when I stepped on the scale in his office, I was 259 pounds. Today, I'm 233 pounds, which is, it's only been like 5 months. And I feel fantastic. I think the defining moment is the way that I feel, and I've learned to listen to my body. I had knee surgery um, about a year this month, yeah. And I noticed that after the surgery, even within 2 months after the surgery, after all my healing was done, that my knee still hurt, was still aching. So I was taking Celebrex. I was taking 200 milligrams of Celebrex in the morning, 200 in the evening. It's an anti-inflammatory to help alleviate the pain inside my knee because it just kept hurting. I couldn't squat down. There was a lot of pressure. That's the other thing about the ketogenic lifestyle um, is sugar affects you at a cellular level. I mean, it causes a lot of inflammation in the body. And so my knee was just swelling. I noticed I had puffiness around my neck, my eyes, um, and I haven't taken the Celebrex in over 5 months. So within a month of being on this lifestyle, after speaking to Dr. Shaw, I haven't taken any anti-inflammatories. I can actually squat down. The pain completely went away. Sometimes I'd wake up in the morning and just walking to the bathroom out of bed, I notice, the center of my foot hurts, my lower back hurts, my knees hurting. And after I walk for, 20, 30 minutes, and it all kind of goes away, but I can still feel that it's faintly there. I have like zero pain, no more inflammation. And it's because of the way that I'm eating, the lack of bread and lack of sugar, and no sodas, a lot of meat, a lot of vegetables. I feel fantastic.